Okay, when giving a IM injection, you're going to want to do the things that you do for giving any type of injection, such as your safety precautions. As whenever you check the orders, you're going to want to check the MAR 3 different times. You're going to want to check it whenever you are getting the medication out of storage. You're going to want to check it when you are preparing the medication. You're going to want to check it at patient's bedside. You're going to want to make sure to wash your hands before preparing the medication and before giving the injection. You're going to want to do your 6 rites of medication administration, which is going to be, you're going to want to check and make sure it's the right patient, right route, dose, drug, time, and documentation. So you want to check those every single time. And then whenever you are getting the medication out of storage, you're going to want to check the expiration date, and you're going to want to check that it's the right medication, all of that. Okay, so whenever you're getting the medication, you're going to check the doctor's orders. You're going to check for allergies, anything that the patient might have that would react differently to the medication. And then you're going to perform a slight assessment depending on what the medication is. If you're giving blood pressure medication, you want to check their blood pressure, pain, whatever. You're going to assess before and after. So you've got the medication, you're going to prepare it, you're going to open up the alcohol swab, you're going to clean the top of the vial. You're going to have your hands washed previous to this. Clean the top of the vial. Then you're going to inject air. However much air you're going to withdraw of the liquid, you're going to inject that air. So we're going to say that we're going to give 3 mLs. So you're going to inject 3 mLs of air, and then I'm going to pull out 3 mLs of the medication, but I got a bunch of air because my vial's pretty empty. Okay. 3 mLs, and then you're going to want to expel any excess air that you have in the syringe. Okay. Alrighty, and then you're going to recap it for safe transport to the patient's room. Okay, so you've got the medication prepared. You're going to want to label that. And then when giving an IM injection, you're going to give it into 4 places. You're going to do the ventral gluteal area, and then the dorsal gluteal, you're going to give vastus lateralis and deltoid. So we'll just pretend this is deltoid. So you're going to go into the patient's room, introduce yourself and others. You're going to wash your hands. You're going to scan the patient's bracelet. You're going to do 2 identifiers, the same things that you'll do for every injection. You're going to go through all of those. So then when giving the injection, you're going to make sure that you clean the area really well. And after you get that medication, you may want to change the needle just because it can dull the needle. So you want to make sure the needle size is the correct length and the gauge. And so you'll want to change out that needle for that. You don't want a dull needle. Okay, so you're going to the patient's room and you've cleaned the site. You're going to have your gloves on. If I can get them on. And after you clean that site for, you don't need to pinch up to get fat, but you can kind of hold to get the muscle to stay in place. You're gonna pinch to make sure that muscle stays in place. And when giving an IM, you're going to it's a 90-degree angle for the IM injections. Okay. So you're going to ask again the patient if they have any allergies, anything like that. And then whenever you're giving the injection, you're going to do a dart-like motion. I'm going to do that. You're going to inject that medication, but we're not going to actually inject it because it's fake. Okay, so you inject the medication, you would withdraw the needle, and then you would put that in the sharps or the biohazard container, and you would clean up all of that. You would assess, I'm going to put that medication back in. You would assess, I've got a lot of extra air in there, I'm just going to pull it out. Okay, you would assess the patient, ask how they're doing, inspect the site to see if there's any bleeding, any discharge, anything like that. And then a little bit later after you give the injection, you're going to want to check and make sure that it is being therapeutic for the patient, that it's actually working and doing what it's supposed to do. And then you can put a Band-Aid on it if the patient, it's not really, you can if you want to. And then that's that.